if you're a therapist, then I can guarantee you want an interventions cheat sheet for your notes. You want to make your notes easy and fast. And today, I'm here to help you. Hi, I'm Dr. Maelisa Hall, founder of the free private practice paperwork crash course. And today we are going to go through how to create a cheat sheet, and I'm going to give you some sample interventions that you can steal right away. But before we get started, make sure you hit subscribe below so that you don't miss any future videos to help you out with your notes. Okay, let's dive in. So the first thing you want to do if you're making your own interventions cheat sheet, which is what I recommend rather than taking from someone else who might be using a lot of interventions you don't even use, the first thing you want to do is actually use it as a prompt. So each of your interventions, instead of being just one phrase or one word, is going to be the beginning of a phrase. And that way, you'll be able to personalize each of these interventions, and your notes will almost read like full sentences. However, it's going to save you a ton of time because you won't actually be writing out full sentences. And because you'll have this cheat sheet that you can use as a checklist or as checkboxes or as prompts, it'll be really easy for you to write because you won't have to rethink all of these different interventions every single time you write a note. The next thing you want to do for each of these items is to make them specific and meaningful. So make sure that you are not just copying and pasting the same thing over and over. It should really highlight how that intervention played out during that session with that client. So that way your notes actually tell a story and make sense instead of reading like the same old thing and not really giving you any information later on. Okay, so let's dive into 10 different interventions that you could add to a cheat sheet and some ways that you can use them. Assessed. So most of us can use this regularly. Definitely you want to have this on your cheat sheet. You can assess client symptoms at the beginning of treatment, throughout treatment. You can assess client progress throughout treatment. This one is a must-have. Challenged. So a lot of us actually do this with our clients. We might challenge one of their statements regarding, or you might challenge a thought related to something specific. So if you have something like challenge thoughts related to in your cheat sheet, then it's easy to personalize that, but you're not having to write out the whole thing every time. Demonstrated. So if you follow a specific modality, this is a great one to put in there because a lot of modalities have specific interventions that you might be demonstrating. So you can say demonstrated mindfulness technique of, demonstrated communication strategy of. Our next one is also a must-have for pretty much every single therapist out there, and that is explored. So you can say explored the onset of, a diagnosis, symptoms that occurred, an incident that happened. You might explore feelings related to, and that could be almost any and everything, right? From almost every session that you use. Evaluated. So you might be evaluating the consequences of a certain action your client took, or you might be evaluating the benefits of a choice that your client is considering. Identified. We identify all kinds of things. So you might identify alternative coping strategies that your client can use. You might identify triggers related to specific outcomes or triggers related to specific symptoms. Labeled is a great one to include. You might help your clients with labeling feelings. You might help them with labeling triggers that they've experienced. You might help them with labeling patterns that they experience in their life, or even labeling behaviors. Especially if you work with children, this is a really, really popular one. Normalized. We normalize all kinds of things for our clients, and it is hugely beneficial. So it's a great one to have on your interventions cheat sheet. You might normalize the experience of something or normalize having certain feelings after a certain experience. Reflected. So we often reflect things back to our clients so that they can see what they're presenting. And lastly, processed. We process all kinds of things with our clients. So you might process feelings related to a particular event. You might process a fear that they have about something in particular, or you might process emotions related to a specific person. So hopefully this helps you get started on your own interventions cheat sheet and shows you how you can make it personalized and meaningful to the notes that you write. We have lots of trainings on notes, so make sure you check out the case notes playlist so that you can learn more about how to make your notes really easy, but also really clinically sound. Happy writing!